think this is the right way to do it. Hi. I think my volume is up. You should be able to hear me. Can you hear me? It's my first time going live. I see. Thank you, number one fan. Oh my goodness. Listen, this is so odd because I've never gone live. Like, I've been live on TikTok before, maybe once or twice, but it was the weirdest thing ever. I've never done it again. Like, I just felt so weird. Thank you, loud and clear. All right, I guess we'll wait for some more people to join. I think it's telling me that there's about 10 people on here. So, hi, hello, everyone. At first, I was like, should I do this live? Should I join live? But I was like, I told the people I would be live. So now I can't go back against my word because everyone's going to call me a flake. My friends always call me a flake in real life because I'm always like, yeah, I'm going to do this. Yeah, I'm going to come. And I'm just like, no, I'm tired. How's everyone doing on this wonderful Sunday? The weather wasn't too bad out here in Baltimore. I think the high was 62 degrees. So it wasn't bad. I only went out one time for the day. My skin is glowing. I have the kitchen light and I do have on some makeup. Always wear makeup. Thank you though. Yes, and she delivers. Oh my goodness, this is so weird. So anyway, let me just jump right into the story because I'm not even gonna keep you all waiting because obviously you're here. We need to catch up and chit chat. Initially, I was going to make a video on the recent activities or like just like life updates, I guess, what I've been up to. And sometime in October, I went with a group of friends to Trinidad. Any Trinidadians in here? It was my first time going to, no, second time going to Trinidad. I went to Trinidad once when I was 6 years old. And then every year there's like some parties that happens that my friends attend. I'm not a party person, so I only attended one party. But I did go with them and I actually had a pretty good time. I came back from Trinidad and I was invited to a TikTok event, which you all saw. I posted on that. I went to New York for a TikTok event, which was rather interesting. I was really surprised that I was selected because a lot of the creators, I don't even consider myself like a creator, but a lot of the creators that were there had, some of them had like 1 million followers. Like I met this one lady, she does immigration law and she does a lot of education on TikTok about immigration law and she had over 1 million followers. So mostly everyone that I ran into had like 90 something thousand followers, 100,000. And here I am with my 26,000 TikTok followers at this creators event. But it was interesting. It was definitely an experience. Let's see. Since then, I told you all previously that I did pass my NP boards. So I did my boards with the ANCC. Yeah, so that means I am FNP board certified. So my initials will be FNP-BC. There's 2 different certifications you can take as an NP. So I took the one where it's considered, it has the initials BC. But anyway, did that and I have been applying for jobs. And I'll be quite honest with you, at one point, I was questioning, why did I even go to NP school? Like, thank you so much. I'll try to read the comments as well. I'm like, why did I even go to NP school? Because I'll be honest with you all, I don't have a huge interest in being a provider, like a primary care provider. I don't have any interest in working in a doctor's office where I'm seeing patients and managing their overall health. I am one of those nurse practitioners where I will tell you that a lot of the patients these days, especially in urban settings, in rural settings, are so sick with so many comorbidities. I don't want to deal with that. I think it's best for a medical doctor to manage those super sick patients. And I know a lot of nurse practitioners might disagree with me, but for me personally, I just don't think the kind of training that we get in school really prepares us to care for those super sick patients. I think those patients, I'm talking about the ones that might have diabetes, hypertension, COPD, sleep apnea, high lipidemia. They just have a slew of issues. They're on 20 plus medications. I believe that they should be managed by a medical doctor because the medical doctor has the training. Giving me the wrong medication. Yeah, I mean, there's this whole battle going on, like NP versus MD, and I'm just always confused as to why are we having this discussion. Like, the doctor is the doctor. We already know the doctor has done extensive training, way past what any nurse practitioner has done. We already know that. It should be a collaborative effort where, as nurse practitioners, there is a space for us. But this whole fight between MDs and NPs, I think it's unnecessary. So I have always loved the field of wellness. Let's see, I am glad you said it. I totally agree on this because the care I see, it is no slight on me. Yeah, it's no slight. Like, I don't know why some people take it to heart because we're not trained the same way. A medical doctor goes to school 4 years of college. You're going to have put you in a position for a reason. Thank you. The doctor goes to school for 4 years. They do intensive pathology. They just do intensive physiology. I mean, coming out of school, they mandatorily must get into residency and train hours in a hospital setting before they can even go in and practice. And then if they want to specialize, it requires way more like training. You have to do fellowships. I'm just gonna get some hate from the other NPs, but I totally agree with you. I know. I'm like, should I be saying this? But yeah, one of my good friends, I don't know if any of you are on TikTok. She has a really large TikTok following. Her name is Dr. Chiz Ikeji. She is she's trained in geriatrics. So she did a geriatric fellowship at Yale. And then she's also an ICU doctor. She did a critical care fellowship at UPMC in Pittsburgh. And I mean, that's a whole lot of training. So like, there's no comparison. I mean, we need to stop. People shouldn't be upset about that. But I have no interest in being in primary care. I considered maybe gerontology. I probably should have done gerontology because I absolutely adore old people. I don't know if I told you guys this about me. The kind of nurse that I am, I love my patients when they're 80 and over. I mean, I love them all regardless, but when they're over 80, I just love them. I just love geriatrics. I love old people. The other day I had a patient, he was 21, and I kept asking the intensivist, I'm like, why isn't he in pediatrics? Why is he over here? They're like, he's an adult, ma'am. And I'm like, oh God, great. And he was my patient. I mean, I took good care of him, but I prefer old people. Like, I like my 80s and up. It's my preference. But yeah, so back to me being an NP, I never saw myself working in traditional medicine, seeing patients, managing all of their comorbidities. I love the wellness industry. I thought I would love aesthetics. I think I do love aesthetics, but there's different levels in aesthetics. I don't see myself injecting people's faces with filler. I don't believe in that. Like, for me personally, I don't feel like I have the authority to tell someone, oh, you should fix this hair and fix this here and put this here and let's put fillers here, and your face is not balanced. Like, who are you? Who are you? But that's people's choices. Yeah. Oh, AGMP. Yes, I love the geriatrics. So for me, I'm still a little bit confused as to what exactly it is I'm going to do, because let me tell you guys how I got hired with okay, this is so embarrassing. Okay, initially I thought I wanted to be in that kind of aesthetics, right? So I got hired with a laser hair removal company. Because here in the state of Maryland, you have to be a nurse or a nurse practitioner to do laser. Other states, you can just be an esthetician and they'll hire you as a laser technician. So I got hired a few weeks ago as an NP working in laser hair removal. I went to the first part of the training, which was okay. And then I started going to the hands-on portion, and that's when I was like, what am I doing here? Like, what exactly am I doing? So I did complete half of the training. And guys, sorry to say, I actually resigned from that job. I told them that I don't think this is a good fit for me. Number one, a lot of people on social media glorify like aesthetics. And I know I started off in laser, but laser hair removal is no joke, especially if you're working for like a chain that focuses solely on laser hair removal. When I tell you that those girls are seeing clients, they're not patients, seeing clients back to back to back to back to back. Literally, we worked for 9 hours. This is excluding the half an hour lunch and the 2 15-minute breaks. We worked for 9 hours, and the technician I was with, she saw 29 patients. She lasered 29 patients. The appointments are scheduled back to back to back. There's hardly any downtime. You don't even get time to breathe. You're constantly like, oh my goodness, my next patient is here. My next patient is here. And all I'm sitting there thinking is that I don't even work like that at the bedside. Would you like, how can I say, oh, this is how I see the comments. Wait, let me go back down because I think I missed some stuff. Hold on. I didn't use my MP degree for 2 years until my RN job was laying off. Good. MP screwed me given the wrong medication. I'm not really surprised, I should say. I'm glad you said it. I totally agree. And that is only, yeah. It is no slight on MPs. Agreed. You're going to have more weight when you're expressing a concern. Thank you. Yes, I'm definitely going to get some hate. I'm cared for in a family medicine practice. The NP is never in a rush and answers every question and give me a choice in my care. I've heard great things about having NPs. I'm not saying that they're not great at all, and I'm not saying that they don't have a place for them. I just don't believe that NPs are equipped to manage the patients who are super sick with 15 different comorbidities on 30 different medications. It's just a lot of management. You're new to my channel. Thank you. Dermatology, I don't know. I didn't really do well in derm, in like integumentary, like all the different rashes and pustules and all of that. Not my favorite thing. You're getting older. Yeah, I love geriatrics. Would you like the OR? Certain surgeons have NPs and PAs work in the office and they come in surgery days and assistant surgery. I don't know. Yes, Grace. Oh my goodness. So let me tell y'all about the laser job, honey. Let me tell y'all. I don't even know what to say. Okay. So basically the job is 10 hours a day. Okay. So they hired me full-time, right? So, okay, cool. I can take it full-time. But then these were the red flags I ignored and I should have known. Hire me full-time. I read through the package. No paid time off. I would have to request time off, but the time off, which was 10 days a year, would be unpaid. So all I'm imagining is me on vacation and I'm coming back to no check. No check. No check. So it was unpaid time off. Then the medical benefits was kind of like sketchy. I'm like, what? I didn't even understand what they were trying to do. I was like, are you guys trying to have me on state benefits? Because I don't understand, right? Like, so that too was a red flag. Then the scheduling. They hired me full time, and they didn't ask me my schedule preference. I said I'm open, you know. But then what I should have taken into consideration is the company is not based. The company doesn't really cater to nurses. They're only using nurses in the state of Maryland because they have to legally. So my schedule was work Monday, off Tuesday, work Wednesday, off Thursday, work Friday, work Saturday, off Sunday. So when I sat and I thought about the schedule, I was like, y'all got me working every Friday and Saturday? Every Friday and Saturday? How? I'm like, not even as a nurse at the bedside, you can get me to work every Friday and Saturday unless I request it. How are you giving me this schedule? And y'all know I'm a nurse coming from the bedside and you guys want me to work every Friday and Saturday, 10 hours? manual labor, standing up, doing laser, bending my back, breaking my back. So then I was like, okay, the pay wasn't bad. I'm going to be completely transparent. They were paying $65 an hour to start, plus tips. Now, this company is located in a very upscale, ritzy area of Maryland. So the tips was going to be on and popping, okay? During training, I was with an esthetician training in Virginia because that's where they sent me to train, in Virginia, even though I would be working, yeah, laser, like laser hair removal. I would have been working in Maryland, but I trained in Virginia. No lie, guys. Last week, when I was with the esthetician, one day she made like 200, no, 2 days. So the one day I was with her, she made $310 in tips. One of the other days that I wasn't there, she made $278. And the last time I was with her, which was this past Wednesday, she made $400 in tips. So I ain't gonna lie, I did the math real quick and I'm like, I'll be working in a more high-end area. So $65 an hour plus all the tips. Oh yeah, I'll be making bank. Like, that's good. But then, honey, when I got down to doing the physical work, I said, oh no. And it's not even so much about the physical work, it's the pace. It's the fact that they have patients scheduled. Patients were scheduled back to back, nonstop. So that means, like, if I had to use the bathroom, it would be rush. And I was watching the esthetician as she's working, and she's literally anxious. She's literally rushing through the job. And like, she's like, oh my goodness, my next appointment is here. I have to hurry up and do this. Everything was a rush. And I was like, first of all, I'm too old. I'm too old to be having this kind of stress on me. Not only am I old, I'm perimenopausal. So I already have that stress. And then y'all want to add more stress to me? Rushing to see these patients? Barely could go use the bathroom? Nah, I couldn't do it. I was coming home and I was like, you know what, Kendra, it's okay. It's just training. Stick with it. You know, it's a good foot into aesthetics. It's a good skill to have, you know. But then I was like, no. Couple of times, I didn't really get to do the hands-on portion as much as I would have wanted to because she was such in a rush to get through her appointments, which is what I highlighted in my resignation letter. I said, you know, I'm new to laser. I've never done it before. So if you all want for me to learn properly, oh, it's worse than floor nursing because at least in floor nursing, I could take my little breaks when I want. I could hide my little coffee, you know, on my on my workstation. I could have my water bottle. I could go drink a cranberry juice, you know, eat a graham cracker if I wanted to. There is no time for that. You know, I could sit and chart and rest my tired body sometimes at the bedside. But what I told them in the resignation letter, I said, you all are not allowing for training to happen. Because how are you going to schedule her for the same amount of appointments knowing that she has to train me? So whenever it was so I got to practice on her. I did do some practicing. She allowed me to laser her arm. I lasered her legs and I lasered her Brazilian because there's a whole lot of people laser in the Brazilian area. Okay. A whole lot of that going on. And she would let me do that because like a client would cancel last minute. So we'd have like 10 minutes. But of course I have to take my time because I don't want to burn her. And then it would be like, okay, hurry up, because we have to get ready for the other client to come in. And I'm like, well, hello, like I'm learning. You're in the area. You're in the aesthetic area. Yeah, laser hair removal is part of the aesthetic area. Yeah, it is. But I get the pace of it. I understand. Like money has to be made. I understand for business purposes. But when it comes down to training someone, especially if you want to retain, because the specific location that they hired me for, they have a hard time retaining the nurse practitioners. Because think about it. Most nurse practitioners will go there and say, wait a minute, I did all this running at the bedside. Like y'all not about to run me to the ground when I went to school for a degree that would allow me to have a little bit more ease when it comes to working. You know what I mean? The physicality of it was a lot. But it's just the rush. The girl that was training me, she told me she'd been working there for about a year. And she's like, I've gained 18 pounds in a year since I started working here, I gained 18 pounds. And then I said to her, I asked her, I was like, well, why is that? And she's like, oh, maybe I'm just eating too much. And I'm like, no, I think you're stressed. Your cortisol is high. Your nervous system is rattled because you're busy trying to keep up with these appointments. So it was a lot. So I put in my letter of resignation. They reached back out to me on Friday because I resigned early Thursday morning. I sent them the letter like, I'm not coming back. Thank you for the opportunity, but no thanks. I don't find this to be a good fit for me. And so they emailed me back. The manager reached back out to me. She's like, well, do you need more training? And I'm like, it's not about more training. I was like, I just need more time hands-on. I said, because I'm learning how to use a laser machine. So I'm learning hand-eye coordination as well as foot coordination because there's a pedal underground attached to the machine. For those of you familiar with laser, it's a Kendra machine. So to activate the handheld piece, you can use the handheld and activate it, but the foot pedal is more efficient. So you're learning like hand-eye coordination. I'm like, can I get some more hands-on? Because I spent 2 full days observing her. Then the next day, you guys wanted me to do the treatments with her observing me, but she was going to rush me because guess what? She still has to get through these appointments. That was the issue. So like when you're at the bedside and you're, if a new nurse is being trained and she's paired with a preceptor, you don't give the preceptor a full assignment. You don't give the preceptor a full assignment. You give the preceptor sometimes just 2 patients, especially if it's like med-surg. And let's say typically a med-surg nurse has 5 patients. If you're training, they'll cut you down to 2 or 3 patients. And you as the med-surg nurse will take 2 patients and you'll give your preceptee, the person you're training, 1. So that way they have time. But I get it, it's the aesthetics industry. Everything moves fast paced. But can y'all have at least reduced the appointment time? At least cut out 5 appointments to give us a little more time. Like, how do you expect me to learn and be comfortable? And this has to do with people's skin. It's like people are lasering their face, facial hair. I don't want to burn anybody because God forbid I burn someone. Now we're here. There's like legal issues and I can't afford for anyone to go to the board of nursing and report me saying that I caused them all these problems and I burnt them. And now it's all these like liability issues. And now my license could possibly be at risk. Like, I can't afford for that. Sorry, guys, I'm eating grapes. Seedless. Terrible. So that's the issue with me now. However, I do have a few things lined up for this week. I have 2 interviews coming up, so I'll let you know how that goes. I haven't fully finalized everything with this laser company. I mean, they seemed open and they wanted me to come back, but I don't know. What do you all think? Should I give it a try? I had initially told them too. I was like, oh, once I noticed what was going on, I said, oh, I can't work here 4 days a week. I was like, I need to work here 2 days a week. And they were like, okay, that's fine. We'll just reduce you to part-time. You can pick 2 days a week to work from. Because once I saw what was going on, the busyness of it, doesn't have to be full-time like that. Yeah, 410s will be full-time. So I told them, I'm like, cut me down to part-time. Give me 2 days a week. Let me get my feet wet and let me learn to be comfortable using this machine and just getting used to the pace. And then eventually I'll be able to bump it back up. But I don't know. It's just been a lot going on. And with that, I still work at the hospital. You guys know I work in the ICU. With the kind of benefits that they were given and the no paid time off also, I'm like, I'm just going to keep my hospital job because the benefits at the hospital is great. I get PTO time and I actually enjoy that ICU that I'm currently working in. Amazing doctors, amazing staff. I mean, I've just really been enjoying it. And the one thing I've always told myself as a nurse, no matter where I go in my career, I would always want to keep one foot at the bedside. It's very important for me to always be current in hands-on care at the bedside. And the reason for that is because I did clinical instruction for many years. And in order to be an effective clinical instructor, I think you must be current at the bedside. I also learned that when the pandemic happened, my current bedside experience was very handy in working in the pandemic, to where I didn't create any harm to any of the patients I was caring for. You guys remember during COVID, they pulled so many nurses back into the bedside who had no clue how to care for patients at the bedside. I mean, they had nurses telling lies basically that they were ICU nurses and were caring for patients on the ventilators, that they didn't even know what it meant to care for a patient on a ventilator. So I always want to be current in bedside care, because if anything happens in this life, at least I know I'm still current and I can always get a job. So that's one of the reasons why I stay at the bedside, on top of the fact that I genuinely do enjoy direct patient care. I know bedside nursing gets a lot of flack. Like, we're always talking about how awful it is and how terrible. And yes, it is, simply because the hospital's administration makes it bad. But the actual act of caring for patients is something I enjoy. Okay, interacting, engaging with my patients, especially my elderly patients, enjoyable for me. Okay, it actually feeds my soul. So that's one of the reasons why I tell people that I will always stay current at the bedside, even if it's one day a week, even if it's 3 shifts a month. You will always find me at somebody's bedside caring for patients. Sorry, I'm chewing. Let's see. Yeah, so the job that I got hired for full time, I would start work at 9:30 and I would be done at 7. And I would get 2 15-minute breaks, which are scheduled for me, and a 30-minute lunch. When I experienced that, I was like, all right, cool. So we're in a 15-minute break. Honey, as soon as the break was done, there was a client sitting in the waiting room waiting. As soon as lunch is done, client in the living room, in the waiting room waiting. I'm like at the bedside. Like, no one dictates my breaks and my lunches when I'm working at the bedside as a nurse. I can take 15 breaks. No one will ever know. I can go on lunch so long as I have someone covering my patients. Or if the hospital setup is where the break room is near the nursing floor, sometimes I'm like, I'm right here in the break room eating my lunch. If anything's going on with my patients, I'll come out. I don't even mind. But for laser hair removal, oh no, honey, everything is scheduled, and you better be finished that lunch at 12:30, because at 12:31 there'll be somebody waiting for you in that waiting room. I don't see the. Hold on, where are you guys? I don't see. Okay, here it is. Let's see here. Yep, breaks are important. Benefits are needed. Yeah, benefits are definitely needed. What hospital? I can't tell you what hospital, because y'all know. I can't tell you. I really wish, but unfortunately, like with social media these days, people, like to call people's hospitals, and people like to get people in trouble. But I wish it wasn't that way, but it is. Bedside care keeps you humble. Oh my God, yes it does. Because the one thing I know going into work, when I look at my patients, I'm like, no one asks to be here. Like, no one asks to be sick. You know what I mean? Even when my patients are disgruntled and they're doing the most, and even if we fuss and I'm like, you're doing the, because I have real conversations with my patients. I'm like, come on now, you're doing the most. I also understand. I put myself in their shoes. I put my kids in their shoes, because you guys know I have 2 daughters. And I think to myself, oh my goodness, God forbid, if this was one of my children, even as I get old, I think about my children in their old age. I wouldn't want nobody treating my child poorly. You know what I mean? So that's important for me, to be at the bedside and to be good. They never want to provide quality training to NPs. Yeah. I would love it if after NP school, I mean, they do have residencies, very limited spaces for nurse practitioners to get into residency, into some residencies, but it's like far and few in between. Very competitive, far and few in between. Did you finish NP school? Yeah, I finished last year, but I just took boards this year. You bought green grapes today. I hope they got seeds. It's hard to find grapes with seeds. These don't. I typically don't eat grapes that are seedless, but these were looking really plump, so I picked them up and I was like, I know these are GMO because they're so sweet. Oh, my sound is coming in and out. I'm so sorry. Did it get any better? What do I do for my sanity? I don't know. I don't know. I need to start exercising again. I need to start walking. I don't really have anything hobbies. YouTube is kind of like a hobby for me. I love the process of editing, putting the pieces together. Like, I love that whole process, but I'm not always consistent because I've been working. I'm always like, I feel like I'm always at work. Poor sound. Is the sound any better? No? I don't know what's going on with it. I might have to, I don't know. I'm on my Wi-Fi, which is pretty good. Someone says they hear me perfectly fine. I don't know what's going on. Tell me, for the people who say I'm cutting in and out, am I still cutting in and out? Did you say RN, retired at 35 years? I didn't love working with the doctors. I was in critical care, and after 12 shifts, they'd come in the morning and tell me what the patient needed. Yeah, I think it depends on the physician. Some doctors really value nurses' input. I haven't really had too many bad experiences working in the ICUs with different doctors. It was one during COVID. It was one doctor. She really pissed me off. I didn't stay on that contract long. Let's just say that. Some people are saying it sounds fine. What happened to Pilates? I don't know what happened to Pilates. I need to start going again. I actually canceled my membership because I wasn't using it to the best of my abilities. I think I was just working a lot. So I think one of the questions I had, it's related to me working. Someone had asked me a while ago in the comments, like, they were like, if you're an NP, why are you still working at the bedside? Or something like, why do you have two jobs? And I was like, as a nurse, I've always had two jobs. And I have to remind people, I also have two kids, right? I have two daughters. My oldest girl is 22, but she's still very much my adult child. And I have a 14-year-old, right? So part of me working as much as I do, part of it stems from trauma. I'll be honest. Part of it stems from trauma, and part of it is because I feel that I am required to provide my children with certain things that I didn't have. Like, I feel like it's my duty. And when I say that, I'm not talking about material things. I'm talking about experiences. I'm talking about being able to pay for tutors, being able to pay for summer camps, being able to pay for just certain experiences. You know what I mean? Like, as a nurse, people think that nurses make so much money. You have the ability to make a lot of money, but you're going to work hard. So that's just part of it. You know what I mean? It's not like I get help. Like, my children, their dad is very present and he does what he's supposed to do. But at the same time, like, if I want my oldest daughter, she always went to very good summer camps. My kids go to private schools because I'm a firm believer that when you have children, once you're able to, you should provide them the very best. You know what I mean? You should provide them the very best. Like, I tell people, I'm not working hard out here and I'm not working two jobs to like buy Chanel bags and have like, I don't care about that stuff. Like, material things don't bother me. You know what I mean? I'm not into it. It's not my thing. And this is not me speaking down or judging anyone that's into that. It's just not my thing. I prefer experiences, and I prefer to spend my money on my children so they can have experiences. Like, for example, in the summertime, they go away with their dad's family. They go to the beach or whatever, so they get nice hotels. I give them money for food. It's just a lifestyle that I have to maintain for my children as well. It's not only just for me. Unfortunately, I had a challenging day with an unexpected death. Yeah, unexpected deaths can be very hard. Over the years, I've just learned to manage, but it's very hard for me. I've just always had this position though, like life is not meant to be forever. That's just always have been my outlook. Like we are here for a time, which is why I try to make the most use of my time. And when I waste my time, I get very upset with myself. But death is inevitable. I have conversation with my kids all the time. Like, life is not meant to be forever. I try to prep them because life is not meant to be forever. So we make the most of it. So usually when my patients pass, I'm just like, they've pretty much served their time and it was just their time. I hope that doesn't sound insensitive. I hope it doesn't. I try to be very realistic when it comes to death. Okay. Tutors are definitely expensive. My oldest daughter, I always had to have a math tutor for her. I always had to have a math tutor. I always put her in summer camps. Like just a lot of programs I've exposed her to. My youngest girl, she is an academic, so I don't really have to do much for her. But the piano lessons, the volleyball clubs. My oldest daughter played club soccer for many years. So all of these things cost money. Then plus I take them on vacation. And then when you have daughters, I'm not buying one box of sanitary napkins. I have to buy 3, 4 in one trip. I have to buy, if I go buy deodorant, I'm not buying one deodorant. I'm buying 4 or 5. You know what I mean? I'm buying multiple toothbrushes, toothpaste, because I have 2 other human beings that stay here with me. Nurses don't understand finances. That I don't agree because most people weren't raised to learn about finances. I definitely agree. The monster drip, my ICU gatekeeping, yeah. Does the live accident I don't even know if it like automatically replays. I really don't. But yeah, I also that video that I did on that video that I did that talked about the toxicity in nursing, when I talked about the young lady who I trained just for that one night, who she'd been experiencing a very tough time with her preceptor. I think most of you must have seen that video. Honestly, when I did that video, like I did it the morning after I came home from that shift, and I was so disappointed in what she was experiencing. I had to share it. I had no clue that video was going to go as viral. I had no clue. It went so viral that people in the hospital I was working with saw that video and would ask me, like, Kenz, did that happen here? Was it here? Was it in the ICU here? And I'd be like, y'all saw that video? I'm talking about like the entire nursing education department saw it. I'm surprised I didn't get terminated because, like, it's so fickle these days and funny with all the social media rules and concerning what you say and what you can't say. I'm surprised that I didn't get in trouble for that, but I didn't. I don't know. I tell people all the time, like, God favors everyone differently, and that's why it's always allegedly, right? It's true. It's true. It's true. But I do believe in God. I believe in God's favor. I think, a lot of things that I've experienced and that I have been able to experience and even go through, it's a lot of it is just God's favor. That's why I didn't get fired. I'm like, whoa, God, you really did, and you really looked out for me, because that video went viral. I think as of right now, it's probably at like 1.3 million views. It's still the highest viewed video. I still get a whole bunch of comments on it. Yeah, I didn't share anything. I didn't look any names or anything like that. But I was really surprised at the feedback at that video got. And y'all want to know what I'm most mad about with that video? Because when I came home from work, and I think I took a nap, and I got up and I was like, let me share this story. And I threw that wig on, right? Why a couple of people commented on the wig? They was like, oh my God, your hair is terrible. I was like, this one man was like, yeah, your storytelling skills is excellent. But he was like, that wig gotta go. I was like, wow. But I'm the kind of person, I don't take stuff to heart. Like it's not much that you can say to like hurt my feelings. I'm pretty open, you know what I mean? I figured like I put myself out there in a public space so people can comment as they please. And now that I look back, I can't even watch the video in its entirety because the wig is so terrible. No, don't watch it. Don't rewatch it because you're gonna be looking at the wig. Don't look at the wig. The wig is so terrible. So that's pretty much what it is. But one of my quests in being an ICU nurse, a lot of times people go to the ICU because they want to go to CRNA school. I never wanted to be a nurse anesthetist because I'm too all over the place for that. First of all, I don't want to be stuck in one place for my shift. I like to walk around. I like to leave. I might go get a cup of coffee. I might go talk to my friend in another unit. I am too much of an extrovert to be stuck in someone's OR. I can't do that. But one of my main reasons for going to the ICU was I was a clinical instructor. I taught at various schools here in Maryland, like a lot of universities and a lot of community colleges. And one of the colleges I taught at, a lot of my students wanted to go to CRNA school, but they had a hard time getting ICU practicum. They had a hard time getting into the ICU. They would get turned down all the time. So once I became an ICU nurse, one of my main things was to bring in students to do their practicums. So I went to my manager, she contacted the education department, and I would take on 2 students a semester from the same university I taught at. I would bring them on the ICU so they can get their practicum hours and get exposure to the ICU. I did that for years. It was one of my main reasons why I stayed in the ICU, so that students can come in and shadow me and work alongside me for their practicum experience. That was one of my reasons. Yeah, doing that video about that ICU incident also taught me that it's not just ICU, it's the labor and delivery, it's the NICU, it's PICU, all those like critical care areas where there's like gatekeeping or where there is like, specifically Black nurses. I can't speak for any other minorities, but I can speak like, there is some gatekeeping. I think it would be silly to say that, oh, it's not true. Like I've had some people in my comments say things like, oh, well, that didn't happen to me, or my ICU isn't like this. Okay, that's fine. That's your comment. But if you read through a vast majority of the comments, everyone can share stories into the negative experiences that they've had and they've encountered within the ICU. Initially, when I applied for ICU, they didn't even want to hire me. They wanted to put me in the ICU step down, and I had to tell the manager, no, thank you. I was like, I didn't apply for step down. And the recruiter called me back a week later, and she's like, they were so impressed with the way you interviewed. We have openings in the ED. Would you like to try? And I was like, sure, I'll try emergency room. I mean, it can't hurt. So I went in, I did emergency room for 1.5 shifts, and I was like, this is not me. My brain does not work like an emergency room. Emergency room nurses are crazy. If you're an ER nurse, you're crazy. The way y'all brains work, my brain cannot handle the madness. I promise you it can't. I was in that emergency room confused as I don't know what. I was so confused. And my preceptor was terrible. She was awful. But even if she was great, I was just like, I don't know what's going on. And I'm the kind of person where I know right away if something's a fit for me or not. I was in that emergency room like, so how many patients can y'all take care of at a time? How you know when to send this person upstairs? This person over here, like what? They don't assess the whole patient. What is going? I was so confused. The next day, I said, let me try again. Halfway through that shift, I went to the manager. I had my badge. I was like, listen, I appreciate your interest in wanting me to work in your department. Thank you for the opportunity. I said, but this is not for me. This is not for me. And that lady, and that's why I feel like God put you in certain situations and God grants you favor through certain human beings. Like certain people you might encounter, you might think it's just coincidence. I don't believe in coincidence. Coincidence is God's way of remaining anonymous. Because that manager, I think her name was Holly. Holly looked at me and Holly said, no, Kendra. She was like, I don't want you to resign She was like, I know initially you wanted in the ICU. You wanted ICU. She's like, you can go home. But she's like, I promise you, I'll call you in a couple of days. In a couple of days, Holly kept her word. Holly called me. She was like, Kendra, on Monday, come back in and you're going to be on the ICU. Someone resigned or someone left or whatever, and they have a opening. All of a sudden now y'all got an opening. Less than 2 weeks ago, y'all was telling me no, y'all didn't have nobody, no space, and wanted to put me in step down. And that's how I got into the ICU. L&D, triage nurse. Yep, lots of problems. My skin looks great. Thank you. I'm wearing some foundation from MAC. No, Clinique. It's a Clinique. Clinique foundation, the old school. Can you be an NP at the hospital? FNPs, family nurse practitioners, I believe can work in the emergency room. Do I have any interest in that? No. I love the wellness industry. So if I were to get a job working with like a functional medicine doctor, or if I were to go to school and get a certification, I'm not taking on no school loans though. I'm done with that part of my life. If I can get a physician to work under him as a functional medicine NP, naturopathic medicine, I love wellness. I love the wellness industry, which is like preventative medicine. I love alternative medicines rather than traditional medicine. I like, supplements, giving vitamin B12 shots, hormone replacement therapies. Like I love that aspect. So maybe, hopefully, I can find my way into such a field. I do love aesthetics as far as giving a little bit of Botox. I don't mind giving a little Botox. You got a little wrinkle here? Sure, I'll give you some Botox. But that's as far as it goes. I'm not in the business of changing people's faces and telling people, oh, you need to lift this, insert a thread here, like put filler in your chin. Like, no, that's not for me. I don't know. I'll just have to find my way. Look into health coaching. I know. I've heard about that quite a bit. Like health coaching, nurse coaching. I've kind of looked into it. So I don't know. I'll see what happens. In the meanwhile, I'll just be working on the ICU until I figure it out. Hopefully something works out for me this week with the interviews I have lined up. And then I'll just continue applying for positions that I see fit. But I'm not worried. Like something will come up. And if in fact, I make peace with things in advance. If in fact I'm never meant to work as an FNP, that was just God's plan. I didn't take out any school loans for my FNP. When I tell y'all I worked during COVID and I saved a good bit of coins during COVID. I paid off a bunch of bills, saved a good bit of money. My COVID money paid for my FNP postmaster certificate. It was like $27,000 cash. I paid my tuition. So I should be looking for a return on investment, right? I should be. Yeah, the emergency room, the patients in the hallway. I can't. You're internally brilliant and awesome. That is why. Oh, thank you so much, Kevin. You're very kind. How to keep skills sharp, but you love home care 1-to-1 ratio, right? I know. I mean, PRN it in a hospital. You could look into health coaching, geriatrics. Yeah, I know sometimes you have some doctors that round in the nursing home and they hire NPs to round on the patients. I can definitely do that because I love nursing home patients. But I think I'm going to end up like my friend Stephanie. So I have a friend Stephanie. Let me tell you guys a quick story. Miss Stephanie. Stephanie is a palliative nurse practitioner, right? I worked with Stephanie on the floor for years. Stephanie's this white girl, and Stephanie has no chill. Stephanie was rounding on patients in a nursing home. And she went to one of the locations and there was a patient. She said she looked at him and she can tell he was very sick. She said he was very sick. She saw when the nurse took his vitals. She said his vitals were like 70s over 40s. She said the patient was sweating so bad. She was like, he was febrile, meaning he had a fever. She said he looked awful. Mind you, this is not her patient. She's not coming to see this patient. She just happens to be a passerby, like observing this situation. So she said she asked the nurse, what is going on with this patient? Oh, whatever, his blood pressure's just a little low, but I'm going to put an IV in to start giving him fluids. We already called the doctor. The doctor knows, whatever the case is. Stephanie tells her, this patient can't be managed here in the nursing home. He needs to go out. No, 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 no. The doctor already knows. The nurse is now giving her attitude because Stephanie obviously isn't minding her business, as she never does when it comes to patient care. So Stephanie is like, no, I think this patient needs to go out 911 because he is very sick. You can't manage this patient here. This patient is septic. So the nurse is like, well, I don't know why you're here saying this and saying that or whatever the case is. We already are in contact with the doctor. We're going to put a line in. Stephanie said, you're not going to be able to get an IV in him. He is septic. Like, he is very sick. He needs fluids and he needs to be in an emergency room in the ICU. So they were giving her pushback. Stephanie pulls out her cell phone. 911. She calls 911. She was like, yes, my name is Stephanie. I'm a nurse practitioner. I'm here at such and such location. There's a patient here that's very sick that needs to come out. He needs to be sent out and I need you guys to come get him. So she calls 911. When the ambulance shows up, the nursing home, like the nurses, they're pissed. They're like, oh, who do you think you are? You don't work here. You came in here. You called 911, blah, 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 blah. Like, that's not, you weren't supposed to do that or whatever. She's like, I don't care. She's like, I'm witnessing a patient who is going to die if he stays here with you guys. So I'm doing my due diligence and I called 911. So the next day, Stephanie boss calls her and she was like, Stephanie, what happened yesterday when you went to go round on your patients in that nursing home? Stephanie was like, yeah, I was rounding on my patients and I came across a patient who was very ill. She was like, the patient needed to go to the hospital. So I called 911. And the manager was like, oh, wow, because we just got a call from the director of nursing and they don't want you back in the facility. Stephanie was like, they don't want me back. So what does that mean? She was like, yeah, I'm going to have to switch you and the other nurse practitioner. Like, your patients that's at that facility, you're going to have to hand it over to your colleague and you're going to have to take hers. Stephanie was like, that's fine. She was like, it is what it is. But she was like, I'm never going to stand by and see a patient dying and not do the right thing. Stephanie don't got no behavior. None. Still to this day, no behavior. But yeah. Oh, you're so welcome. Welcome, welcome. 3 days in a row. Third day. Oh my goodness. 12-hour shifts. 3 in a row. It's a lot. By day 3, you're just like done. Different types of jobs NPs can do in my scope. Well, primary care, FNPs can work with any part of the lifespan. So from babies, from pregnancy, babies, early childhood, like pediatrics, adolescent care, adult care, into the elderly. We can work with the entire lifespan. We can also work in emergency rooms, urgent care settings. Yeah, pretty much primary care offices. Stephanie is definitely an angel. She does not play around when it comes to her patients. I'm definitely not white and would never manage a patient I'm not assigned. Yeah. Well, she wasn't even working there. But you know what? Sometimes you just have to do the right thing. Sometimes you just have to do the right thing. Sometimes, like, for the sake of your conscience as a nurse, if you see something wrong, like she was very much an experienced nurse and she had worked as a nurse practitioner for at least 3 years, and she saw that this patient wasn't being treated. Like, there's no way you can manage a patient whose BP, blood pressure, 70s over 40s. You can't manage that patient in the nursing home. Even in the hospital, if that patient is on med-surg and the patient has a low blood pressure, they're also exhibiting other signs of decompensation, the patient has to be upgraded to the level of care that can manage him. Patient cannot be managed in the nursing home. That patient more than likely will need to be on pressors. Pressors are the medications that we use to help maintain the blood pressure and the MAP, so that way all of the organs in the body are being perfused. The patient, blood pressure 70s over 40s, more than likely his MAP, mean arterial pressure, is underneath the 60 or the 65 mark, and the organs are not being perfused. Yeah, sometimes you have to stand for something. Sometimes you have to stand for something. She didn't get fired. They just took her from that nursing home. She still kept her job. They just the director of the nursing home was like, I don't want that nurse practitioner coming back here. Because in a nursing home, let me tell you something that I learned that you all might not know, or you might know. In a nursing home, whenever they send a patient out to the hospital, it's considered a red flag, meaning that the state has to go in and conduct an investigation, right? So nursing homes oftentimes do not like sending their patients out. They like to hold on to the patient and try to treat them in the hospital. In the nursing home, even if it's to that patient's detriment. Because I'm telling you, for those of you who are nurses or work in healthcare, a lot of times when you get patients from the nursing home, the patient is knocking on the door of Jesus, okay? And Jesus is in the bathroom putting his robe on saying, I'm coming. That's when your patients are coming into the hospital from the nursing home. They keep them there for as long as they can, and they try to manage them. And when they realize, like, oh, this patient is about to be on his last 3 breaths, that's when they call 911. So by the time we get the patient in the hospital, we're like, what the hell is going on? How long has this patient been like this? Why is the patient just coming to the hospital? Why is the patient blood pressure 60s over 40s and he's just getting here with his heart rate in the 140s? What was happening all the times leading up to that? They hold on to them until they can't, because they want to avoid having the state come in to look at the chart. So it's not even for the benefit of the patient why they're keeping the patients. It's terrible. Yeah, when patients come in from the nursing home, they're terrible. Yeah, Toya, they don't like sending patients out. It all has to do with like numbers in the state and all that nonsense. If you're in a DNP program working 312 med surg shifts, stressed out with small kids at home, would you leave for a part-time job with less stress? Whew, this one's a tough one. I probably wouldn't leave. I would probably reduce my workload at school. Probably. Or you can try to enlist the help of family. I don't know how feasible that is, but 100% tuition reimbursement is a big deal. Yeah, that's a big one. That's a big one. I would probably try to reduce my school load, maybe stretch it a little bit. Instead of taking a full-time class load, I would probably take a part-time. Yep, nursing home patients coming in such a bad shape. Or if you're in an FMP, DNP, are you able to reduce the DNP portion to the masters? Yeah, if you have family that's in the nursing home, you really have to stay on top of the care. You really have to stay on top of them, because like my friend, when she called 911 for that patient was on his way to being probably dead. When we get patients from the nursing home, it's like, what in the world? The wounds, the contractures, what is going on in here? And depending on where that nursing home is located, I don't know, nursing home care is just bad overall. It's bad. The only how it's okay is if you have family members who stay on top of their family members' health and is present. Yeah. Okay, guys, I'm going to wrap it up. It is 5:36. My girl has volleyball in the next 40 minutes, so we're going to volleyball. You're already part-time, and no, it's only DNP. Woo. I don't know. That's a decision that you're going to have to figure out. If you leave the job where you're no longer getting tuition reimbursement, you can take out loans, but do you want to take out school loans? I don't know. Do you want to? Depending. I don't know. I don't want any more school loans. I already have an undergrad loan from my BSN that, I didn't want any more loans. Even when I did my master's, I did it through, I got it paid for 100% by the state of Maryland. I think you might just need to reduce your class load. If you want to go the PA route, PAs get a more solid education. Well, that's another big argument. The PA education follows, I think, more of the medical model. I think the knowledge base is definitely more. The schooling is definitely hard. The clinical rotations might not even be in the same state, but it's a solid education. However, PAs cannot practice independently. As a nurse practitioner, you can practice independently. Yeah, nursing homes are terrible. They're definitely overworked. All right, thank you all for joining me for live. It's my first live. I think it's an hour, so that's long enough. We will have to catch up again another time. I appreciate you all. I will be pumping out more videos now that I barely have a job. Now I only have like one job because I did quit my eating disorder job at the mental health. Wait, did I quit? No, I think I went PRN. I went PRN. I'm done with that part of my life too. So I'll keep you guys updated, okay? I have 2 interviews this week. Wish me luck, and I will keep you all updated. Thank you all so much for your support. Thank you for listening to me run my mouth, and I will see you all again. Love you all too. Bye. I feel the love, by the way, guys, all the time. I really do. I really do. Thank you. See you all again.